So the beauty of naturopathic doctors is that we're medically trained to understand mainstream healthcare, but we're also able to spend so much more time with our patients. We also bring more of a holistic perspective as well. So that gives me an advantage because I can really dive deeper into a patient's health, especially in those situations where, they've seen all the specialists, they've kind of been through the ringer and not really gotten answers, or everything still appeared normal. Working with me is almost like the opposite of a usual one concern per visit model of a doctor's appointment, which most people are used to in Ontario at least. And that's just kind of the way our system is set up. So I'm here to provide more of a compassionate ear while being able to also address all the organ systems, including emotional health, because we can't ignore the importance of the mind-body connection. And also using data to really drive, which direction we're going to take. And so by that I mean lab work. I can work with any past labs that somebody's medical doctor has run. I'm able to do a little bit more functional testing, things that maybe were missed, so that not always necessary, but sometimes that can just be that missing link. I also hold a master's degree in nutrition science, so I personally use a lot of nutrition in my treatment plans with patients. I find that that's often the missing link in a lot of medicine. Most mainstream medicine doesn't include much nutrition talk at all. And so I start kind of wherever my patients are ready. It's not one size fits all at all. But there's really no out supplementing or out medicating a poor diet. So we can't ignore that. So yeah, I'd say like the number one thing that I see are patients with extreme fatigue, digestion, or hormonal problems who've, like I said, gone through the ringer, seen every specialist, and everything's coming back normal. And so that's where I can do my job to find those missing pieces and be that investigator to get to the root of their health problems.